What is a microchip? Why would you put one in a dog? No, it does not. A satellite does not track this with a GPS and let you know where your dog will be. But a microchip has a number, and when it's under the dog's skin, it can be scanned, and then the number comes up on the scanner, and that number corresponds to an account on a database that has your information. So the needle, or the microchip in this needle, is injected under the skin, and then if the dog is lost, then a veterinarian or shelter will use, or police station will use this wand, and they'll scan for the microchip, and the number will come up like I said, and that number corresponds to information. Now this needle,
pull straight off.
yeah,
Maybe? Yeah.
you can tell I don't usually do this, usually the techs do it. The needle is pretty big, and that's one of the biggest issues. You have a little tiny dog, that's a pretty big needle to put under the skin, but it's usually just a moment of pain. And the wonderful thing is, if you can keep an animal busy while they're getting the shot, they might not feel so much. So we'll show you how we do that. Huh, Kuma? Look at Kuma. Kuma's a big old shepherd. He's actually one of the smartest, prettiest dogs that I have in the practice. And he just drives his owners crazy because he's always wanting something to do. And the cool thing is he's been on my homemade food, dog dish diet food, since he was a puppy. You can see how pretty he is. He's not fat. His coat's beautiful. So the owners have been crock-potting his food and feeding him since he's a little baby. So check out Dog Dish Diet if you want to find out about that. But anyway, what we use sometimes is we just use baby food and as a treat, and they have to lick inside the jar and it keeps them busy. So we'll go ahead and put that down, and then you can come right over here, Isabel, and you can see he's getting busy here. Now I'm just actually going to pinch the skin, and I'm going to poke that needle through, and then I'm going to push the microchip in. And then I'm going to take the needle out, and the little plastic devices push the microchip under the skin. Then I'm going to use the wand, and I'm going to see make sure the microchip is in there.
There it is.
So now it shows that the microchip is under the skin, and Kuma now, if Kuma ever gets out and gets into a shelter, or a veterinarian scans him if he gets lost, or police department, then they'll find that number corresponding to that chip. Look at, I'll show you, I don't think you got to see very well how I injected it, but let's just pretend I'm going to do it again. I have the cover on the needle, but when you inject a dog, there's more pain back in here if you ever give vaccinations. But if you give a vaccination right up on the dorsal midline, I like to give it up in this area. So that's where the microchip is. And you know, you'd think I should prep the area and put alcohol on it, and we just, after thousands and thousands and thousands of shots, I've probably given, oh gosh, maybe 100,000 shots in my 30-year career. And in those 100,000 shots, I've never gotten an infection abscess. We've had reactions to vaccines. Some dogs just react to vaccines, but I've never gotten an infection. Let's knock on wood. Well, why would a shot hurt more here and less here? Well, just do this to yourself. Right in your back. Pinch yourself right there. Ow. Now, pinch yourself in the neck. You'll see immediately why, Kuma's bored. You'll see immediately why it hurts more when you give shots in the flank area. That hurts. So if I gave myself a shot there, it would hurt a lot less than a shot here. Yeah, shot. I got that right. So microchips have been, a lot of people write me and ask me about microchips and cancer. There's been some thought that the microchips cause cancer, but from the information I found for research shows that there's not a good correlation. And in all the hundreds and probably thousands I put in, I've never really seen a tumor around the site of a microchip. So I feel pretty comfortable. All my animals are microchipped, my own dogs and cats. And I don't feel like that they're in danger from it. So that's kind of the way I feel about it. And Kuma, you're a good boy. What a good dog. You're such a pretty dog. Are you a good boy? Huh? Have you turned your parents' backyard into a moonscape because you're bored? Yes, you have. Have a great day. Remember that just having a microchip does not ensure that your pet will get back to you. Whoever has it or wherever it gets lost, the people in charge of the pet at the time have to get it scanned by a police department, a shelter, or a veterinary technician. And hopefully that will happen if you get your pet microchipped. Another thing is the correlation between microchips and cancer. I've read some research, but that in a very small amount of cases it may, but the research isn't convincing, and my own experience has been good with microchips, so I'm not really that worried about it. I think there's a lot more things to worry about. Bad nutrition our dogs get. Take treats. They're probably one of the worst things you get. Grocery store treats with weed in them, they cause lots more problems. Itchy ears, itchy skin, chronic bowel problems than microchips will ever do. So keep your dog away from the bad stuff, bad nutrition, and also over vaccinating older dogs. There's some evidence that vaccines titers last for 7 years, and dogs that are in their teens probably don't need a lot of vaccines. That's another thing that I think is far more dangerous for dogs. Anyway, well, you have a great day.